A patient refuses a recommended medical procedure. Which document should be used to formally acknowledge the patient's decision? So option A says the medical orders for life-sustaining treatment, or the MOST form, and you might have seen that as the pink document that a patient will bring that has all of their wishes for while they're in a facility, such as the emergency department, and what they would like to have done in the event where life-sustaining treatment is needed, if they consent to CPR or not, or intubation, anything like that. But that would be a form that they fill out prior to the point of needing it, and it relates to life-sustaining treatment. It wouldn't be used in the event of just consenting or not to a certain medical procedure in general, so we can eliminate option A. Option B says power of attorney, and that just has to do with someone who can make decisions for them. It doesn't have to do with their decision to formally acknowledge a procedure being done or not, so we can eliminate that. Now, you might feel that you are between these last two choices here, because option C says informed consent, which has to do with a patient giving an okay or not for a procedure or something to be done, given that they are given all of the proper information to make that decision to the best of their ability. And then option D here is the patient Bill of Rights. And with the Bill of Rights, those are the set of what the patient should be aware of for what they can have the right to do. So they have the right to dignity, they have the right to make their own decisions. So you might feel like you're not sure between these two. Now, something to keep in mind is that the informed consent is actually part of the patient Bill of Rights. In their Bill of Rights, they have the right to an informed consent. But between the two, we want to know which one would be the proper document to use to show that the patient refused the care. And when we show that they refuse the medical procedure, we want to show that they refuse while they're in the right state of mind, and that they refuse given all of the proper information that they need to make the best decision. Because if they make a decision they don't want something, but it's because they actually didn't fully understand what they were agreeing to or not, then that wouldn't be a fair consent or disagreeal. So in this situation, we would want to go with the informed consent document in order to document the patient's decision to not have the medical procedure done.